Thank you so much, Dr. Asretkar, for giving us the insights on the first two patients. And I'm sure parents would like to hear from a parent who took his kid for the clinical trial. So let's hear from Bruno Ramalho on enrolling my child in a clinical trial, the GAIN-CTNNB1 experience. The floor is yours.
Hi, thank you very much. Are you enjoying the conference? It's been nice. Very nice talks, right? Oh, we start with this scary picture. So I'm just going to talk about our experience in the beginning that we all know of, how it starts for every one of us. Some of us get their diagnosis first, earlier. We only got our diagnosis at almost 3 years old from a father. And we did what I think what all of us did, which is therapies, early intervention. And it's a very scary time because without a diagnosis, we don't really know what to do. So we just follow what doctors say. Oh, just do your therapies, do your early intervention. But then there's the diagnosis. We have a name for it, and we find a community, and we find our place for this, and it changes our life. We can see a path forward. Unfortunately, when we got there, there was nothing. There was no treatment. We're just following, what other parents are doing. We go into the Facebook group, the parents' Facebook group, which is a big window that opens up, and we follow what others are doing. Oh, you're giving this medication, levodopa. Oh, let's try it. It's promising, but there's no really a treatment. But that's when for us, we started working for CTNNB1 syndrome, helping families, trying to do whatever we can to move this forward. I'll be quick about it. And then also, using my expertise, I tried to build tools for families, not just helping with our excellent Facebook group, which all parents know, and we help each other. We can go there, ask questions, get answers from parents that have their kids which are older, and they know more than us, so it's very helpful. But also, I started doing things to help. So first thing, I created a chatbot connected to research, to the few research articles that we had in the beginning, but it was, I guess it was useful. Parents could ask questions in their own languages, which is a barrier for many families not speaking English very well. So I think it's good to get informed. I built a mobile app. Did I say that I built a mobile app for CTNNB1 syndrome? Did you have it installed? Do you? Yes. And so this is very helpful because there are news on the mobile app. You can see what's happening for CTNNB1 syndrome. You can see the events. You can see your kids on the map if you give me the location of your kids. And you can follow the events, the existing events, which is very, very helpful also. So multilingual, very important. Hopefully, I will add more languages in the future. Some families have asked me. I will try and do it. We also created an association in Portugal to help families. Following examples from the Spanish families, who are awesome. So access to information is very important for us, for all of us, and I think this is very helpful. So this is all very important as a community to participate in the natural history studies. We need to understand how the disease develops through time. It helps researchers for the clinical trials, and research. So it's a burden. We have to come with our kids to these conferences. Some flights go well, some flights not so well. Our kids keep banging on the chairs on front of us. And parents and other people are looking at us. Oh, can you kids stop? No, we cannot. Sorry. So, but it is something as a community that I think we are working hard to participate and support each other, and this is very important. Raising funds. I've seen our organizations, CTNNB1 Foundation, CTNNB1 Connect&Cure, the Association from Spain. We are all trying to fundraise because nothing of this is done without money. Spila and Samo, they did a lot to start the research for a treatment, which was awesome. And because we just refuse to stay silent and don't do anything because nothing happens, because we are too rare to care, as Spiel often says, too rare to care. We are very few, but I think what we did in 5 years was awesome. And then we're here, clinical trial. We were pre-selected, and then us and other families had their pre-interviews, and we were selected. We had already fundraised in the past for therapy, to get to a therapy, to do the research, as other families did. But this time it was Mafalda. So we understood right away, okay, this is going to be very emotional for people, friends, family, and friends of friends. So this is the time we should fundraise more, because I think being emotional, because it's your kid, people are going to be more, they want to give you more. So we use that. So we went to TV shows, newspapers. We created a GoFundMe, we created Mafalda's page that we had before, and we did it. We fundraised a lot. We donated to the foundation to help with costs, and I think we were very successful. Not as successful as Spiel and Samo, but yeah, I think we did good, and it's important because until some rich guy comes along and says, "Oh, there you go, here's the money, do more doses, treat the kids," we are hoping for that. And so suddenly we got a call. The second patient, as some of you know, couldn't do it. So we got a call, can you come to Slovenia? And I said, yeah, it's in May, right? No. Can you come now? So in 2 days, we moved to Slovenia very fast. And the exam starts. You have to go to the hospital a lot of times, do all these exams because there is an eligibility criteria. And all the time I was telling Mariana, at any time in one of these exams, they could say, okay, she's not eligible. So that's always on the back of your mind. You know that at some point they could say, oh, sorry, you have to go home. But yeah, we were there, did all of the exams, stayed there for a month. And then, actually, my father loves to go to the hospital. She's even mad at us because we promised her in the morning leaving the house to the hospital. She's always asking, when are we going to the doctor? We're like, it's tomorrow. Okay, it's tomorrow. And then she asks again, when are you going to the doctor? It's tomorrow. Okay. And we get there and we tell her, oh, they're going to listen to your heart. They're going to do all these things, check your pulse, and they're going to take your blood. Fine. And then suddenly we were preparing to go home again, and she does a tantrum like our kids do. And we're like, what's happening? What's happening? And she's like, blood. You didn't take my blood. Oh, sorry, little lady. Let's take the blood. She loves to take blood. Mariana is like this, but my father is like, take my blood. And so we reached treatment day. which is very emotional. I think everyone that gets their kid through a surgery, it's always, you never know what's going to happen. So we were there waiting in the morning. It was all morning for surgery. And then suddenly you're there, calm, not calm. There's nothing you can do, just wait. And you get someone passes by and says, oh, there's a delay. And then your heart drops. There's a delay for what? And then a few minutes later, oh, there's nothing. Everything is good. Thank you. And then they say it's over, and they call you in, and you go inside, and you see her like that, and it's scary. All those wires, and she was asleep, opening her eyes, but not really there. She was dozed off. And then Damien tells you, you can go home for the night. She will stay here with me. So thank you, Damien, for staying with my daughter during the night in the ICU. And Damien learned some Portuguese words. Thank you very much. So she wouldn't feel completely alone. So some Portuguese words, and that was very nice. So she stayed 1 week at the hospital. I think in isolation, of course. She stayed with her mama, with her mother, and thank you, Mariana, for putting up with it, because I guess it was hard to be a week inside a room, isolated. But after a week, we came home with Mafalda, and it was very positive. She was very healthy, no problems. Just try not let her scratch her head, because she was really trying to scratch the wounds, the scars. So always putting the net on the head. Don't scratch your head. You want to go to the hospital? No, that's different. She remembered that being 1 week at the hospital was enough. So she's like, nah, I don't want to go to the hospital anymore. So don't scratch, please. But then the behavior issues started. Actually, 1 day before surgery, we gave her prednisolone, and she grabbed the sheet from the bed, and she was like crying, very emotional, and like, oh, something is weird here. This is gonna be good. So steroids are very complicated, because our kids already have behavior issues, you know. So 10 times worse. So suddenly she starts crying, she starts biting herself, she starts throwing everything in the air, because steroids also make her very hungry and angry, but very hungry, so she wants to eat all the time. She wakes up in the morning and she wants to have lunch. It's not lunchtime. Yes, it is. Give me lunch. And if you don't have whatever she's asking, I want pasta. Oh, there's no pasta, there's rice. Pasta! So behavior issues are a thing, and we're hopeful that we can taper it down soon enough. But she's doing very well, and we're hopeful for the little signs we're already seeing, because it's only 1 month and 2 weeks. But we noticed some things right away. In the first week, I was cutting her nails, which I do since she was born. And when I touched her fingers, they were so loose, totally loose, no tension whatsoever. And I was like, oh, Mariana, come here, look at her fingers. You can move them. It's, whoa, that was incredible. Toes also, very spastic, no spasticity in her toes, which was, whoa, awesome. And then we started trying some things like the toilet that Damien already showed, and it's there. I told her, why don't you stay alone in the toilet? Put your hands on your knees, please. And she was like very excited, and she started looking at me, don't you like to be alone without us holding you? And she was like very excited, and she started doing it often, which is very nice. And I started doing exercises with her hands, because she couldn't really do these gestures properly. She's like, oh. And I started, okay, let's turn our hands to this side, not to this side, open, close. And she's like, ah. And something hopeful happened, which is she's asking to walk. Usually I'm going from there to there. Do you want to go in your wheelchair from there to there? Let's walk. Okay, I'll put my hands there. And we saw, like you saw in the video, Damia's video. And she wants to walk. And going up and down the stairs, we're on the first floor at an apartment in Slovenia. And she asks to go on the stairs. Like, oh, you want to go on the stairs? Okay, let's do it. Let's try it. And she's giggling all the way. And for us, for me, I really think that she feels that something is different in her body, how it responds, and she's giggling because she wouldn't giggle. She wouldn't be laughing going down the stairs. And now she's giggling. I think she feels something is different happening in her body. And we feel very hopeful for that. It's been only 1 month and 2 weeks, but we think that, yeah, something is really happening as we are hoping that it will. And so, families to remember. Our clinical trials are not just about science. This is for all families. This is a community. We are all here because we want to participate. We want to help this going forward. We go to natural history studies. Hopefully, with the conferences, this helps a lot because we come to learn more about the syndrome, and also we take our kids to do exams so we can collect data for the development of the disease, how it develops through time. Community matters, of course. All these organizations that are being created all over the world, they help to connect families in their own countries and connect with other organizations everywhere. This is very good. So I just want to thank Mafalda because she didn't ask for this, and we just put her through it because we believe the science. The science is very good, and we think we're just going to do it. You weigh the pros and cons, and you're like, yeah, there are a lot of pros. Let's do it. I want to thank Mariana for her patience, my family. Doctors, researchers, and clinical teams, Damian, Nina, Spila, Samo, and the CTNNB1 Foundation, thank you very much. The Portuguese and Spanish Association, always an example, Associação GAIN-CTNNB1. CTNNB1 Connect&Cure for their work in the United States, trying to find a treatment also there. Very important, and also fundraising. Every donor and every family who keeps showing up. We have a lot of help with donors, which is awesome. So this journey is hard, but we are not making it alone, as we have seen from our 4 conferences already. Okay, thank you very much.
I really don't know what to say after whenever a parent speaks, but one thing I can say that I was very close to Mafalda, and I'm still am, so I'm always excited to see her. Maybe I'll visit in Slovenia one day soon. Thank you so much, Bruno, for telling the story. I'm pretty sure it gives strength to the families. I really appreciate.